Question number 1.
Nurse Mimi is giving education to group of students that pancreas are made of special cells that secrete digestive enzymes and hormones. The cells that secrete digestive enzymes are known as A. Islet of Langerhans, B. Protease, C. Amylase, D. Acinar. The correct answer is letter D. Acinar cells. Pancreas is considered to be both exocrine and endocrine gland. Exocrine as it releases enzymes necessary for digestion. The cells responsible for its exocrine function are the acinar cells. It releases amylase that digest carbohydrates, protease that digest protein, and lipase that digests lipids. These enzymes are excreted through the pancreatic duct, then released to the duodenum through the ampulla of Vater. On the other hand, the islet of Langerhans are groups of pancreatic cells responsible for its endocrine function. It is made of alpha cell that secretes glucagon. It increases your blood sugar level and prevents it from dropping too low. Beta cells secretes insulin that lowers down blood sugar when it is too high. Delta cells secretes somatostatin. This regulates the release of pancreatic enzymes and hormones. These hormones are excreted at the splenic artery for bloodstream circulation.
Question number 2.
Patient Brian reports having extreme mid-epigastric pain that radiates to the back. The patient states the pain started 2 days ago. As the nurse, you know that the 2 most common causes of acute pancreatitis are A. Gallstones and alcohol abuse, B. History of diabetes and smoking, C. Pancreatic cancer and obesity, D. High cholesterol and alcohol abuse. The correct answer is letter A. Gallstones are the most common cause of pancreatitis. When a gallstone gets stuck in bile ducts, it can cause pancreatic enzymes to back up into the pancreas. This causes irritation and inflammation of the cells. Heavy, long-term alcohol abuse is also the main cause of chronic pancreatitis. This is because alcohol causes the pancreas to produce toxic substances that can lead to swelling of the blood vessels in the pancreas.
Question number 3.
A nurse is completing an admission assessment of a patient who has pancreatitis. Which of the following should the nurse expect? A. Pain in the upper abdominal radiating to the left shoulder. B. Pain that worsen when sitting upright. C. Pain that is relieved by defecation. D. Epigastric pain radiating to the right shoulder. The correct answer is letter A. Based on the anatomical position of the pancreas, it is located at the mid-upper quadrant of the abdomen and extends left side backwards to the left shoulder. Thus, pain is mostly felt at the upper abdomen radiating to the left.
Question number 4.
Nurse Mimi is giving patient education that a test will be conducted that will use a scope to assess the pancreas, bile ducts, and gallbladder, which is called A. MRCP, magnetic resonance cholangiopancreatography, B. ERCP, endoscopic retrograde cholangiopancreatography, C. EGD, esophagogastroduodenoscopy, D. CT scan of the abdomen. Let's apply the process of elimination. Option A. Magnetic resonance cholangiopancreatography, MRCP, is a special type of magnetic resonance imaging uses a powerful magnetic field radiofrequency pulses to produce detailed pictures of hepatobiliary and pancreatic systems, which makes option A incorrect. Option B. Endoscopic retrograde cholangiopancreatography, ERCP, is a procedure that uses an instrument that has a camera on the end called endoscope is inserted to the GI tract to assess pancreas, bile ducts and gallbladder, which fits the definition of the scenario given, making option B the correct answer. Option C, Esophagogastroduodenoscopy or EDG is almost the same as ERCP, however, it is more focused on the esophagus, stomach and duodenum, not with pancreatobiliary duct, making option C incorrect. Option D, CT scan or computed tomography of the abdomen is an imaging method that uses X-rays to create cross-sectional pictures of the belly area, which doesn't fit the definition of the scenario given in number 4, making option D incorrect.
Question number 5.
Patient Brian was admitted to the ER with the following signs and symptoms: very painful mid-epigastric pain felt in the back, fever, elevated glucose and vomiting. During the head-to-toe assessment, you notice bluish discoloration around the belly button, which is known as A. Gray-Turner's sign, B. McBurney's sign, C. Homan's sign, D. Cullen's sign. Let's apply the process of elimination. Option A, Gray-Turner's sign, is a condition where an ecchymosis of the flanks or side of the abdomen caused by hemorrhage from retroperitoneal blood vessels damaged by pancreatic enzymes released during an acute attack of pancreatitis. To easily remember this, just remember the words, turn her over on her side, where the bluish discoloration happens. This, however, doesn't fit the scenario given, making option A incorrect. Option B, McBurney's sign is done when a clinician will apply slow pressure over McBurney's point and then quickly release. The presence of severe pain when pressure is released is indicative of a positive test and raises the suspicion for acute appendicitis. This doesn't fit the definition above, making option B incorrect. Option C, Homan's sign, involves forced dorsiflexion of the respective ankle in the suspected limb, then squeeze the calf. If there's deep pain in the calf, it may be indicative of deep vein thrombosis, which doesn't relate to pancreatitis, making option C incorrect. Option D, Cullen's sign, it indicates retroperitoneal bleeding from the leakage of digestive enzymes from the inflamed pancreas into the surrounding tissues. This bleeding leaks down to the umbilical tissues, causing bluish discoloration of the umbilical button. To easily remember this, the C in Cullen stands for circle, which symbolizes a belly button. This makes option D the correct answer.
Question number 6.
Brian, with chronic pancreatitis, went to the comfort room. You noted that the patient's stool was oily, greasy in appearance, which is called A. Steatorrhea, B. Melena, C. Current, D. Hematochezia. The correct answer is letter A. Steatorrhea is an oily, greasy appearance of the stool which can occur in chronic pancreatitis due to the inability of the pancreas to produce digestive enzymes which help break down fats. Therefore, it is being excreted into the stool. Melena is used to describe tarry, black stool, as a result of upper gastrointestinal bleeding such as peptic ulcer and esophagitis. Current is best described as jelly stool made of blood and mucus. This mostly happens to infants and young children with intussusception, a condition when one part of the bowel slides into the next. This condition is also known as telescoping. The pressure on the intestinal wall squeezes the blood vessels and mucosal membranes that causes the stool to have jelly blood output. Hematochezia is used to describe as fresh red blood stools caused by lower GI bleeding, commonly associated with hemorrhoids and diverticulosis.
Question number 7.
Patient Brian with acute pancreatitis is reporting excessive voiding, excessive thirst and blurred vision. Nurse Mimi should prioritize which of the following? A. Check the patient's blood glucose. B. Reassure the patient this is normal with pancreatitis. C. Position the patient in semi-Fowlers. D. Provide a dark and calm environment. The correct answer is letter A. Excessive voiding, excessive thirst and blurred vision are classic symptoms of hyperglycemia. Patients with acute pancreatitis are at risk for hyperglycemia as it has endocrine function, which is to release insulin and glucagon. So the nurse must monitor the patient's blood glucose levels even if the patient is not diabetic.
Question number 8.
A patient who received treatment for pancreatitis is being discharged home. You're providing diet teaching to the patient. Which statement by the patient requires immediate re-education about the diet restrictions? A. It will be hard, but I will eat a diet low in fat and avoid greasy foods. B. It is very important I limit my alcohol intake to no more than 2 to 3 glasses of wine a week. C. I will concentrate on eating complex carbohydrates rather than refined carbohydrates. D. I will purchase foods that are high in protein. The correct answer is letter B. A patient with pancreatitis should avoid any amount of alcohol because of its effects on the pancreas. Remember, alcohol is a cause of both acute and chronic pancreatitis. All other options doesn't require patient re-education.
Question number 9.
The physician orders a patient with pancreatitis to take a pancreatic enzyme. What assessment finding demonstrates the pancreatic enzymes are working properly? A. Abdominal girth is decreased. B. Skin turgor is less than 2 seconds. C. Blood glucose is 250. D. Stools appear formed and solid. The correct answer is letter D. Pancreatic enzymes help the body break down carbs, proteins, and fats as an aid to patients with pancreatitis. As sign of efficacy, stool would no longer be greasy and oily, making option D the correct answer. How many correct answers did you get? I know you got it all correctly, but wait, don't forget to hit on subscribe button and turn on notification bell so that you will be notified for upcoming videos. You can also share this to your friends. Goodbye.